Hello friends, hope you are all okay, you are all enjoying your life and you're also watching my videos. Welcome back to Ultrasound and Radiology teaching videos with Dr. Arshad Nadeem Awan. Today my topic of discussion is Ascites, how we will appreciate Ascites on plain X-ray. So there are three main features on the X-ray. The first, if there is Ascites on the X-ray, abdomen will appear hazy. And the second sign is if the patient is in supine position, the bowel gas will float in the center. So you will appreciate there will be central gases on the X-ray. And the third thing is the third feature is that the side lines or the flank line will be bulging out. So if you did find these three signs, so it's mean that it is ascites. So there are multiple differentials. Let's start looking for the differential diagnosis of the ascites on the plain X-rays. There are wide differential for the ascites. The first and the important one is cirrhosis. You have to correlate with the clinical history and previous record. When you come across these three features of hazy abdomen and bulging flank and centrally abdominal gas on the X-rays, so must look for the detail and must look for the previous medical record. If there is any cirrhotic patient, there will be ascites. The second thing is there may be benign or malignant tumor. Most of the tumor from the gastrointestinal tract and ovaries are associated with ascites. It's not only related to these two organs. In many other cases, there will also be ascites, and sometime in peritoneal metastatic deposit, there will also be ascites. In benign condition, if there is ovarian benign tumor associated with the ascites, that is called as Meeks syndrome. You have to be very careful for looking all these clinical records. The third thing is that is hypoalbuminemia. Any condition which leads to reduce albumin level in the blood is lead to ascites. That is very common in nephrotic syndrome. The fourth one is peritonitis. Tuberculous peritonitis is one of the reasons for the ascites, but that ascites would be particularly loculated and there will be low level internal echoes and loculated ascites. You can pick that on CT images and on X-rays as well. In any condition which is leading to increased vascular pressure distal to the liver will also lead to ascites. For example, congestive pericarditis, congestive cardiac failure, pericarditis, or IVC thrombus. Any lymphatic obstruction will lead to chylous ascites, and that would be because of any trauma, or maybe because of lymphoma, or maybe because of any filariasis. So these are all the conditions in which you have to be very careful. So always correlate the X-ray finding with the clinical records. Keep in touch with me. See you with some other new informative videos. Take great care of yourself. Bye bye.